left ear. So this is 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. As I explained to you yesterday, we have something like 5 or 6 previous operations with the placement of a TORP from tympanic membrane or malleus handle to mobile footplate, and there is recurrent dislocation. Good result for some years, and then again a recurrent dislocation. So we decided for these reasons to do stapedotomy. What you can see here, there's a little bit of a lateralization of the tympanic membrane, which explains the length of the prosthesis. Okay, so let's start with the incision. So I do the same kind of incision running from 6 to 12, something like that, a little bit more than 12 and a little bit more than 6. So it's more something like 11 to 7. And we'll elevate the flap now. So it's a good debate about the vein graft interposition, as we said. As I intend to perform a fenestra on a mobile footplate, I will use a vein graft interposition, and as we said, compared to piston Teflon, I mean, there's no question for me, if you use a TORP, it's mandatory to use something to interpose a kind of tissue between the prosthesis and the inner ear, because the risk, of course, would be a protrusion within the inner ear of the TORP. So it could be, of course, 2 other types of tissue like fascia or perichondrium, but both of them, according to me, my experience, are not as nice as vein graft. So they are much thicker. It's not so easy to stretch it compared to vein, and it could impair the mobility of the prosthesis. So I prefer vein for these reasons. Okay, so now I think we are ready to see that. Opening up the middle ear cleft, and you can already see the dislocation of the prosthesis. Complete dislocation. Ciseaux, s'il vous plaît. There's no more cord tympani. Huh? You can see that. Flaron, s'il vous plaît. Give me 1 minute. I'm going to focus on the prosthesis. Okay, so you can see this TORP, which is completely dislocated. And this is the reason why we decided now to go for some other technique. And it needs to be a very important discussion with the patient to explain that usually we don't do it for mobile footplate. But of course, there is no other solution in this case to try that. I will try the mobility of I will check the mobility of the footplate. Un 9, s'il vous plaît. So you can see that I already put some vein graft last time because I wanted to protect the footplate. And you can see it's still mobile. Okay? Alright. Okay, so now I need to find the malleus handle and try to dissect it a little bit in order to use it, of course. Table level, s'il vous plaît. En avant. Stop. Calmement du marteau. The malleus is there, so it's fine. Calme normal du coup. So of course it's quite loose now because it has been operated several times. So you can see the hypermobility of the malleus. What we say it's a loose malleus, more or less. But the fact I'm going to use the prosthesis underneath, everything will be stable together. What I mean with the TORP underneath. Okay, let's see if I can use it like this. So now I need to determine the length, the distance from malleus to footplate. So this is the position of the tympanic membrane. So I need it's going to be like this, a little bit more lateralized. And I'm going to try this now. Alors, mesureur. Okay, I'm using now the elongated stapes measuring rod. to measure the distance from malleus handle to footplate. And I am between the second one and the third one, which means 6.5. So I will use the 7 millimeter long prosthesis in this case, which I think the previous was probably a little bit too long. But I need to check all these things because it's not so easy. Canne les manches du marteau, s'il vous plaît. Let's see if I can dissect. Mais il est très très tordu celui-là. Hein, bon. There we go. I need to have the malleus a little bit free like this so I can place it correctly. I can place the prosthesis correctly. Okay, now it's fine. Okay, so let's measure again. Measurer. I need to measure several times because you remember that at the beginning you saw this lateralized tympanic membrane which is increasing the distance. And now it's 7, so it's going to be 7.5, I think. Okay, I always add 0.5 because of the deepness of the groove of the prosthesis head. Okay? It depends the shape of the prosthesis head. If you don't have a groove, then you don't have to add anything or remove anything. But if you have a groove, you have to think that the malleus will go deeper into the groove. So you have to take into account this deepness, which is 0.5 usually. Table vers moi, s'il vous plaît. Stop. Maintenant, tête en déclive. Okay, so now what we're going to do is the stapedotomy. Stop. I'm going to use the laser, the Lumini system, which is a CO2 laser with a handheld probe. Aspiration, s'il vous plaît. So now I'm using 0.7 millimeter diameter suction tube. I'm going to start with a laser. Bon. Bon, allez, on va essayer. Est-ce que vous êtes prête?
Oui.
Feu. Feu. No, it's not working. Oh, ça marche pas. Again, this is not working. Ok, bon, donnez-moi la fraise avec une fraise neuve. It's not a problem. I use the macro drill. This is, you know, that's exactly the reason why I'm not using the laser anymore. It's always in. Non, ça sert à rien.
So 0.4.
Pardon me?
The micro drill.
Yes, 0.7. And this makes 0.8 millimeter stapedotomy with 0.7. And I use also 0.7 millimeter diameter sucker on my left hand. Okay, well, so we need to do it very gently, of course. And you see it's already coming here. There we go, it's done, I think. Okay, you can see the stapedotomy already now, okay? You see the fenestra. Okay, it's absolutely fine. So 7.5 will be okay. Let me see again. I'm going to measure now. Mesureur, because I want to be sure with the stapedotomy that it's the same. more or less the same length. Of course, it is important to avoid sucking into the fenestra. Yeah, it's going to be 7.5 will be okay, I think. Alors, donnez-moi la fraise encore. I need to enlarge a little bit the drilling out because I need to have a little bit larger fenestra because of the thickness of the vein in this case. All right, good. So now I'm going to use the vein over it. You see, this vein is quite large. I explained to you that I wanted to have a large one for a better protection and better sealing. Much larger than usual. But I think it is important to do that like this. Okay, so I'm going to place and stretch the vein over the fenestra. So it is important then in this case to take some time to clearly stretch the vein correctly. No, it's not good, so I need to take it away and away. If it doesn't work for the first time, when you try to insert the vein, then you have to try again from the outside. Otherwise, it's not going to work. Okay. So again, facing the intima of the vein, and the adventitial side is on the other side. Okay. Okay, so first just placing the vein, and again it's not good, so I have to put it away and try again. It's important to the way you take the vein originally is the most important thing. If you don't take it nicely, then it's more difficult to place it. Okay, so let's go back. And it's also because she's pretty big. So you stick it to the sucker like this, all around, and then you introduce like with the sucker, using like a real instrument to hold the vein. Calmez, s'il vous plaît. Okay. You see, important to spend time to stretch it. It's now over the fenestra here and sealing all the footplate, which is fine. I'll say it's much larger than only the fenestra. And I think this is good now, okay? Put it like this. Ah. I have problem with the sucker because it's sucking all the time, so I need to stretch it a little bit. Okay. Interesting to see that because the vein is thick, but still. C'est incroyable comme elle aspire la veine là, partout. Voilà, là on est bien. Okay, all right. Now I can use the prosthesis. Okay. So this is a prosthesis with. I designed it with Grace Medical. We have Ossiculoplasty head, and the groove you can see at the center of the prosthesis head, and you see the deepness of the groove. This is why I take 0.5, and the shaft is made in Teflon, 0.4 millimeter diameter, just like the regular Causse piston. So I'm going to cut it at 7.5, so 6, 7, 7.5. All right. Okay, so again, as usual, what I want to do is to first introduce the shaft within the fenestra like this. So it goes down to the fenestra, which seems to be fine. And now we need to see if it's going on clearly, easily underneath the malleus handle. So we need to rotate the prosthesis first in order to place the groove parallel to the malleus handle, like this, okay? Crochets. The light is maybe a little bit too much. Okay, now it's better. And now I will grab the malleus handle, which I already relocated last time, okay? So it's easy for me, and I will try to insert the prosthesis underneath the malleus handle, and it goes well like this. Now it fits well, okay? And you see the fitting is very nice. We see the malleus handle within the groove. I'm going to reposition the flap. Seems to be good. There's not too much bending here or bulging, so it's good. And I think we have a nice position of the TORP. And now, of course, the stability should be better because we have the stability at the distal part of the prosthesis, which we didn't have before. So I can't really see the round window, but curette, s'il vous plaît. Okay, now I can see it. You can see the light in the round window. We're going to try that, but I'm sure about the position, no problem. Yeah, you can see the light moving. And set, s'il vous plaît. I don't want to make it too much, so I just want to stretch a little bit more the vein at the posterior part of the footplate here. Okay, looks fine. Okay, good. So repositioning now the tympanomeatal flap and now the middle cell. Allez-y. Okay.